Welcome to I Wonder Doctor. Today we are with Aaron Mattis, the creator of Active Isolated Stretching. Aaron works with Major League Baseball players, tennis champions, and Olympic medalists.
What he is demonstrating, you can do on your own or with the help of a friend.
Welcome to another segment of I Wonder Doctor. We are going to show you some of the stretches that can be done for the lower back, pain and or preventing of pain. And sitting on this chair, we're going to begin by laterally flexing the trunk. She's going to spread one leg out wider. We're going to place the arm up by the head. I'm going to stabilize by holding the top of the pelvic girdle, and we're working downward very gently. She's doing the work, pulling from the side of her trunk, exhaling as she's working. I'm assisting with 3 to 5 ounces for 1 to 2 seconds, 2 seconds primarily. Good. In the opposite direction, she will spread her right foot as we're moving toward the right. Her arm is up near her head. We're going directly lateral, stabilizing her pelvic girdle as she reaches. We're now going to work at a 45-degree angle to get the oblique tissue in back of the back. We're going to use the abdominals. We're going to turn at a 45-degree angle with the leg spread once again. Her arm is coming inside, reaching toward the inside of the foot as we pull down using the left abdominals going to the left. She's going to contract, she's reaching, and I'm assisting at the end, stabilizing her pelvic girdle. Going in the opposite direction, we're going to bring that foot in, spread the right foot, coming in 45-degree angle of rotation, reaching at a 45-degree angle inside the thigh, exhaling as she comes down. Going at an oblique angle to get the abdominals and the rib cage, which quite often is very tight. We turn the body 45 degrees, the arm comes up by the head, we stabilize the top of the pelvic girdle as she reaches backward. She's going to exhale as she does the work herself. There she goes, and I'm going to let her do that without any assistant this time. Wonderful. Going the opposite direction, we're reaching at a 45 degrees to the right, turning our body, reaching with the side or right side of our body, exhaling as we're reaching. Then we're going to do rotation of the trunk. We're going to move the body into rotation. We're going to use the left side of the body as it rotates. We're going to gently help, spreading the feet a little bit wider for balance, and then turning the body. She will help with both hands, and I'm going to give a little bit of help at the end with my hands, gently. And she can do that now on her own, which is what we will do after we achieve the range of motion to maintain it. We're going to turn in the opposite direction, please, so that her left hand's on the outside of her right thigh. Her other hand will grab the chair gently. She's going to turn her own trunk, and we're going to assist very gently. As she's finishing her turn, we're now helping at that point. Now we're going to complete the two of them as a different unit, so the hands are going behind the head. She's going to rotate her body, spread her feet just a little bit wider, so we're turning as far as possible, and now we're going to laterally flex down, hitting a whole bunch of rotary muscles of her back that we haven't achieved to this point. It's a beautiful stretch for stretching the rotary concept of your back. And those of us that play sports, this is a huge item. We're now rotating in the opposite direction, completing full rotation, and then flexing the body toward the center between the two legs. As with any other, she can also do this by herself when she's capable. Coming down, once she has the range of motion, then she can do this on her own. It may be necessary to do this more than once a day, depending on what you're doing. If you're playing 18 holes of golf, you may have to do it a couple of times out on the golf course. And this concludes the chair portion of assisted stretching.